Good morning, everyone. We're going to begin the intersection of health and housing panel discussion. Going to let people come in at a time. We do have one panelist that is running a little bit late, so she will be joining us momentarily. My name is Tamika Rose. I am the Deputy Chief of Staff for Mayor Horrigan in the City of Akron. And you might be wondering why I'm up here to be a moderator for the panel. My first title with Mayor Horrigan was Health Equity Ambassador, and what we were working on was infant mortality. And what we found out in discovering the social determinants of health around infant mortality is that housing was one of the key indicators of a mother having a preterm birth and or having her baby not make it to the first birthday. So it became a very high priority on our list. And we are now one of the bold goals for United Way. We want to get our black babies, our black infant mortality rate to be the same as the white infant mortality rate of 6 per 1,000 births. Right now it is at 15.3 in Summit County. We want to lower that to 6 by 2028. And we're going to do that by focusing a lot on the healthcare, but a lot on the housing as well, and other medical opportunities. But I wanted to take the time to introduce the panelists. I'm going to let them introduce themselves and tell a little bit about themselves and why they are on this panel, and then we will get into the panel discussion. So, yes, Erica, thank you.
Good morning, everyone. My name is Erica Malone. I am a community health worker with SUMA's African Centering Pregnancy and Parenting Program. I am also a doula in training, a lactation consultant, and teen mother. I'll give more to my backstory here shortly, but thank you all for coming. Thank you for spending some time with us this morning.
Dr. Davidson.
Good morning. My name is Joel Davidson. I'm a general pediatrician at Akron Children's Hospital. I work in an office called Locus Pediatrics in my clinical work, but I also joined this panel as an expert in lead. I'm the kind of regional lead expert along with my co-director. We operate the lead clinic where children who are exposed to elevated rates of lead come to us if they need additional evaluation and treatment.
Keith.
Good morning. I'm Keith Stahl, Director of Residential Services and Operations for Community Support Services. We are a healthcare organization that focuses primarily on mental health. And so we do all the street outreach pretty much for the community. And so we're really working with some of the most vulnerable individuals in our community. So thank you.
Thank you. Jackie.
Hi, I'm Jackie Owens. I'm from Summit DD. We represent and provide services to over 4,000 individuals with disabilities in Summit County. I'm a manager in our Community Supports and Development Department, which connects people to community organizations in the areas of residential, direct service supports. We also work with transition age youth and anybody from birth to the end of life.
Dee.
Greetings, everyone. My name is Dee McCall. I am a community organizer with the Freedom Block and also a co-facilitator for a peer support group for women transitioning out of incarceration through South Street Ministries. I am one of the lead organizers for the Housing is a Right campaign and a coalition, and I am just here speaking on behalf of the tenants of Akron.
Thank you. So we're going to start with Erica. Now, Erica's a dear friend because she does work with us on full-term first birthday. As she mentioned, she works at Suma Health and is a doula in training and a lactation consultant as well. But Erica has a unique story, and she inspires me every day. I'm not going to give her story. Are you able to do it today? You want me to do it or you got it? Okay. We're going to pray for Erica because she came here today, and she's on her way to a funeral. So violence plagues all of our families. And so I just want to ask you to just pray for Erica during this time. And I'm going to let her talk about how where you live affects your health?
So, again, Tamika, thank you
You're
for
welcome.
asking for prayers and grace. I do want to let you all know that being a community health worker definitely plays a major part in who I am and how I move from day to day. I am celebrating my oldest son's 28th birthday today that I had at the age of 13, who turned out to be one of the most amazing men I have ever encountered in my life. He is a Marine, and he saved people in Australia when they were having brush fires and a whole host of other things. But today is also very bittersweet for me because I am burying my stepdaughter today, who was killed in Akron due to gun violence. She's 21 years old, mother of 2. So I am not here just in regards to myself and the family and the community. I am a testament of what growing up in the hood is, can do, will be, can turn into. Where you live, I'm sure I'm preaching to the choir with regard to the social determinants of health, anxiety, toxic stress, having easier access to guns and weed than you do fresh produce. Understand the impact that we all have as individuals to make sure that each one of us shows up daily in the greatest version of who we are. Our zip codes should not affect us the way that they do. Unfortunately, again, all of us that are present, we know that to be true. So I'm saying all of this to say, and I asked Tamika if I could have an ask before, because I can go on and on. I had my second child at the age of 15, but because of my determination as an individual and to get past the drug and alcohol addictions that plague my family to this day, I was determined to not be a typical teen mom, which is why I stand in the gap now and provide services for the women that I care for. Take some time to get to know your city officials, county officials, policymakers. Us knocking on doors and asking is dead. It's time out for it. So now we are at a place where we need to hold one another accountable. We need to make sure these policies and procedures are actually signed and set in place and held as they should be, and not as just another meeting for us to pass the time. I want to thank y'all and ask again for more grace with regard to this. All of us that provide services to these families, I ask that you meet them where they are with an open heart and an open mind and understand that they just didn't show up 15 minutes late because they didn't have anything else better to do. They're having car problems, underpaid, under-resourced. I'm asking for grace on behalf of the people that I stand in the gap for. Medical professionals, doctors, nurses, when these women and men and families show up for their doctor's appointments, don't just shut them down and disregard them because they showed up late and it's a glitch in our systems. You have no idea what they had to do to get there. It's a whole lot of y'all that I'm trying very hard not to make eye contact with, because if I do, I'm gonna break down.
Well, Erica, as I always do, I'm gonna take a pause for you, and then I'm gonna transition to Dee. So Dee, Erica highlighted some of the social determinants of health that I know that you and the Freedom Bloc are trying to rectify in our city. So can you talk about how you envision building healthy neighborhoods? What types of things should we be taking into consideration, and how does Akron's existing neighborhoods measure up?
That was a loaded question. I will break
But I
that
knew where I was placing it, so.
Yes. So I'll start with how do we build those healthy community or healthy neighborhoods? For me, I feel as though that we should invest in the community by developing different programs for the community by the community. Social programs over the years have proven to alleviate a lot of violence in the communities, and a lot of issues that are at hand now are because there is nothing for the community to do. Intergenerationally, it comes from the seniors down to the children. So if we do create equitable programs for the community that is truly intergenerational, we will occupy the time of the community, which will build those relationships. So we will get to know our neighbors, we'll get to know those ladies down the street, and then understand who's who in our neighborhoods. And once we're able to identify that, that's when we'll start bringing that village mentality back. And you said, how does Akron's existing neighborhoods measure up?
Yes.
It is truly black and white. It's either the neighborhood is highly funded or not funded at all. So if we identify the inequities within our neighborhoods, we can see that certain neighborhoods haven't been funded for generations. It makes no sense as to why there are generations of people that are truly just disenfranchised while other sides of the neighborhood is truly affluent and thriving. So we just want to identify the disconnect and then really figure out ways of building those bridges, because every ward gets funding, yet we can't tell. You see the south side being dilapidated, you see the east side, and you see the west side, the north side as well. I feel as though there aren't too many neighborhoods that truly reflect the city of Akron in its entirety, because we're a very diverse city, yet it's truly black and white, where it's highly funded or it's not. So I don't believe that Akron's neighborhoods measures up, because we could do a lot better.
So I'm going to ask you a follow-up. So what types of things should we be taking into consideration to allow for Akron's neighborhoods to measure up?
We should take into consideration that those that are poverty-stricken are also trauma-induced. So when you're going into these situations, you have to go trauma-informed. You can't expect what your experience is compared to their experience. And also when having these conversations with the trauma, it's never ending, and you have to give that grace. With these organizations, like Erica said, we have to be graceful. We have to identify that not all the time everyone has that access to resources, that access to education, or just the access of knowledge of knowing that that resource is allotted to them. There are so many different programs that are allotted to the community, yet getting that message out to everyone in the community has been lacking. Due to the fact that some neighborhoods may seem a little more uncomfortable than others. However, that was systematically made. Based in the book, The Color of Law, a lot of the issues that were in hand is because of the structures that were made. And no one is truly speaking out against it. And here we are now speaking about issues that many studies that were funded, highly funded, identified that there is an inequity within the city. And this is across the nation. So I would say that we should implement programs that is for the community, by the community, and truly bring the people that are directly impacted to the tables to assist and collaborate on how to really get into the community. Because if you're coming in as an outsider, that's colonizing. You're imposing your right onto other people when there may be a disconnect. So I just invite people to bring those who are truly directly impacted to the table to make decisions together as a collaborative and not like a dictatorship.
Thank you. I appreciate that. So we talk about accessibility, and we also talk about diversity and inclusion. And I'm sure none of you watch the city council hearings, but when we were moving towards the pay to stay and source of income legislation, my case was that this was not just about Black women, this was about disabled individuals as well, and people that didn't have enough money. So this was not just about the Black woman, even though, I know that's what people were thinking, but a lot of disabled individuals get turned down for housing too. And this is a conversation about the intersection of health and housing. So I wanted to ask Jackie and Keith, what does accessibility in housing truly mean?
So at Summit DD Accessibility and Housing, we know that right now the access to housing is at a minimum. That affects the community of people with disabilities as well. And then on top of that, accessible housing. So people that might need some modifications to their home to be able to live independently. We're also at a different time and a different point over the last few years with individuals that in housing, there were group homes or congregate settings, people living in larger groups, 5, 6 people. People with disabilities now, and there is a large charge for people to live more independently and not so much in those type of settings. So now we have people that are moving out into the community looking for accessible housing, affordable housing, quality housing, and running into the same barriers that people on fixed incomes or other marginalized populations do. So our job right now at Summit DD is to reach out and connect with our community to provide access for people with disabilities to housing, as well as connecting with the community in a way where we can provide the services or connect with people who might need our services to be included in their communities.
So kind of building on that, so much of what is needed is what the individual wants. And so we really have to take the individual into account, have that conversation with them, and how can we provide those supports to that individual where they want to live. So it's not about us telling them, where they're going to live and what have you, but that they're involved in that so that they have some ownership over that. Even if they're not a home owner, they still have some ownership over that housing that they have. And it's about building more opportunities. So, if you look at an individual that's living off of $750 a month, your opportunities are incredibly limited on where you're going to live. And so you're more or less told this is the housing that's available to you as opposed to choosing that housing. So we've really worked hard, with Akron, the city of Akron, and other community partners to develop additional types of housing. And the housing that we need as an 18-year-old is much different than what we need at 30 and 50 and 70 and 90. And so we really have to have all different types or a continuum of housing where people are able to move within that continuum. And the way that many of our housing programs are set up is that you aren't able to move up and down that continuum based upon your needs. And so you end up kind of stuck. And so that is a piece of accessibility that is often lost on many of our housing programs. And so we're really, we've really worked hard to try and create exit strategies so people can move on to more independent setting. If maybe they're starting in a group home or, a halfway house or something like that, that they can start there and then continue to grow with that as they continue to recover. People with mental health issues, on average, die 25 years earlier than people that don't have mental health issues. And one of the reasons is the environment that they live in. And so they often don't have access to food, transportation. Some of their medications cause side effects, and also they often have negative symptoms, which tend to make people a little less active. And so you add all these elements together, and you've really created a recipe for being very unhealthy. And the type of housing you live in has a huge role in how that those health disparities can play out. So, housing is really, really a key piece of that, and having that accessibility and being able to change within housing is key as well.
Thank you. So, Dr. Davidson, from a medical perspective, patient health conditions can be created or exacerbated by their housing. How do or don't our existing systems link care for these conditions with the governmental agencies that oversee housing conditions?
Say the second part again.
All right. So, how do or don't our existing systems link care for these conditions with the governmental agencies that oversee housing conditions? I think we discussed this a little bit. It was kind of like, so how does lead impact and mold impact our health, and how does HUD coming in, how does that help us or hurt us? And what do we need to change?
Well, there's a lot to this connection between where you live and how healthy you are. We've kind of outlined the complexity of that, and I think some of this starts with just breaking that complexity down into a little bit more of a relationship-based model. And I think that that's what Dee was talking about a little bit earlier when she was mentioning like some of the disparities. I think we're lacking true relationships. From a health perspective, can we think about classic environmental problems like lead? We can also talk about mold and smoke exposure, those sorts of things. It's not really that hard to draw this line between those environments and poor health outcomes. But what do we really mean by health outcomes? We have like all these proxies that we talk about, and you can talk about like of course something like life expectancy or infant mortality or rates of blood pressures or hospitalizations or emergency room visits, and all of this adds to the complexity, quite honestly. And it's really not what we're talking about. When we talk about what is health, we're talking about the fulfillment of the potential of a life to be allowed to do what that life is good at. That's kind of what I think of when I think about health. And we all kind of know what health is when we see it. And we know what it looks like when we don't see it. And it really is based on environment. There's a lot, from a pediatrician's perspective, there's so much pruning, there's so much modeling, there's so much that happens in these first really early years, probably even right after a conception, the development of a pregnancy, the support of that woman throughout that pregnancy, how that person is cared for by the people around them throughout that life trajectory. But especially early on in life, it really does lend to some pruning, some modeling, some rerouting of brain functioning, some ability to respond to stress. And we're talking about stress. This is all really stressful. And I'm not talking about the stress that I feel like as a speaker up here. My hands are getting a little, sweaty. It's the stress that is complicating and confounding and reciprocal and cyclical. And it's the stress that we're all trying to break in the discussions that we're having. Gosh, this room is incredible. This conference is amazing. We have some strengths, but how do we start to then, on the healthcare side, we're really good at measuring stuff. And kind of one of the things that I think that we can fix is try to measure what matters. Let's measure the stuff that we really care about. Let's have some honest conversations. What are we actually trying to accomplish?
Right.
My major health output as a pediatrician is probably high school graduation. But it's not even just high school graduation. It's like, did you graduate and really find something that you're good at?
Right.
Did you find an environment in your educational system that you found people that cared about you? Because we know that those things matter. Does your parent have somebody to turn to when something really devastating happens? Those are the things that matter, but we can't measure them very well. And we can't assess for them very adequately. I have 20 minutes. I love to talk to the people that I talk to in 20 minutes, and I really try to develop a really strong, trusting relationship over time as a doctor with my patients and their families. I really, really want to try to demonstrate the respect that I have for mostly women. And for dads that are out there, I give you credit. Dads, we need really good dads. Kids really do thrive when they have good fathers. They graduate high school more often. Their ultimate lifetime attainment of income is higher. But we're talking about mostly moms in a tough time. Parenting's difficult. Everybody in this room that's a parent knows that that's hard. So how do we start to then connect those real situations that are happening in people's lives to a system that ultimately is not always trusted. And I'm not talking about just healthcare, but let's be honest. A lot of the systems that we've put into place have led to mistrust. There's a lot of roots to that, but I think a lot of that is rooted in relationship. Does everybody even know what everybody else is doing? Does everybody even respect the things that the efforts that they're putting forward? I think that that's what Erica was starting with a little bit in some of her comments was, I got my kid here. In our office, we work really, really hard to see people that come. And you're shaking your head. Thank you. And if you're in my office, I will see you. Sometimes it's a little hard to communicate to my staff what those rules and policies are. So now I'm going to run into that second part of your question.
Okay.
How do we connect those things that we know as care service providers, as people who are trusted individuals within the structures of individuals and families? How do we move those things to an honest discussion within the community about what is really needed? I'm going to kind of go back to one of the things that Keith mentioned, which is let's listen to people. Let's sit around and let's sit across from each other, with each other, and ask the question, what do you need? And let's let that honest answer be the thing that guides us into those policy decisions, into those allocation of resources. And let's get rid of the barrier in a lot of ways that is, oh, you're just saying that because you want something. Let's look at it as, you're saying that because you need something. And we know, and all of this, in my mind, is let's respect the person that's bringing forward that part of their life that they're willing to share. So, Tamika, you are very good at how to make all that work in the whole government system policy-making section. And I'm a big thinker, and I like to think about these concepts, but we got to start to really be honest about what it is that we really need.
I appreciate that. You could say something real quick because I have a question for Dee, so I don't want to forget.
So I just wanted to speak to the fact that Akron and Summit County are very resource rich. We have a great deal of programs and procedures and agencies. We have awesome programming. We have back to school things. We have post-secondary education. We have green spaces. We have public parks. Like Dee was speaking to earlier, where I live on the west side of Akron is a great example of healthcare, mental health, and green spaces and everything coming together in a very, very precise and decisive area, and it's awesome and it is utilized. However, because we have lapses in communication, or so many of our organizations and agencies are not connected, we drop the ball very often. It is absolutely pointless to have all of these resources available and have so many community members have no idea these programs exist. So this is one of those things for me to ask everybody that is here present again today, now that you've been made aware of some of the things that we do have that are available, go knock on your neighbor's door and ask them if they are aware. Take the time out to get to know somebody, and like Joel was just saying, when you ask a person what they need, don't assume you have the answer to their problem. Don't try to fix people. Hear them out, understand what resources that you can assist them in getting connected to, and find out a way to get them connected. We have some amazing organizations and people and places, resources in place here in this area. But again, it falls on deaf ears if nobody knows about it. So get to know where you live. Get to know your neighbor outside of church functions. For any and all pastors and clergy and ministers, everybody hear my heart, because I am ordained as well. However, sometimes you got to meet somebody on the street corner. Sometimes you see a homeless person, you go buy them a burger instead of talking at them, trying to get an understanding of where they are, why they are, or some people choose the life that they have, and we have to be okay with it. But the ones that don't, as humans, we are now obligated. We know different now, so we can show up differently. That's all.
Thank you. So, Dr. Davidson, thank you for the accolades, but I work with a team, and a lot of them are sitting in the audience. I don't know, and I tell people, I don't know everything, and when you pose a problem, I will try to fix it, but sometimes I can't fix it, but we will work together to fix the problem and change the policies. But in our conversation earlier this week, I made a statement, and I said, well, you know, we change these things, but nobody does anything about it. And so Erica just alluded to the fact of go out, you've learned things today. So go talk to your neighbors and say, do you know that this occurs? I think one of the gems in our community is 211. If you have a problem, you can call 211. They will help you. And if they don't have the resources to help you, they will call the city or the county to find out how they can assist that person. But with that being said, Dee brought up the piece that some people have so much trauma that they don't even know where to begin. So Dee, could you talk a little bit more about the trauma that we don't see every day and we overlook, and some of our employees need to take into consideration when people do come to our doorsteps and ask for help?
Thank you. I just want to let y'all know people are dying in these houses, and these conditions are making them sick to lead to death. So it is truly a state of emergency. Many people are experiencing tragedy and life circumstances that leads them into many mental health issues. We're not able to identify all of the issues that these tenants are experiencing because they are the working poor. Because bills never stop, they have to constantly work, so they have to persevere. People are dying in these apartments. People are getting these diseases because their units are infested with rodents and roaches. We have women that have histoplasmosis that is only received by exposure to rat poop. Yet these issues continue to come to the table of these leaders that deals with housing, yet it's still unaddressed. And we have these tenants that bring these issues to everyone who is anyone. City officials, county officials, federal officials. I even had conversations with the Secretary of HUD. All of these issues have been addressed, yet it's still taking its time. And in that time that is being taken, people are still dying. It is a state of emergency. And within that, people are still having to live with the death. They still have to live with these conditions. We just heard earlier today that a woman was living in an apartment infested with rodents, and one crawled on her bed. That's traumatizing. We have to take into address how trauma shows up for people, because it doesn't show up similar to the rest. What trauma may look like in you, it may look completely different to the rest. And a lot of people are truly on autopilot. So they go to work, they go home, and they take care of their families, not understanding that people are truly at a mental war on the inside. When they're alone in the bathroom, they deal with their thoughts, they deal with their traumas to persevere, to continue. So we truly have to address how, if the house does not take care of the tenant cannot take care of the house. And if the person's house, which is their safety, is challenged, how can they feel safe in their own body? So we have to take into part how important housing is, because it truly is a human right. Yet us as people are not understanding that, because we continue to drive past these places that looks like eyesores. It's a nuisance in the community, yet people just drive past it as though that's how that's always been. How long are we going to continue to say that's how that's always been? Neighborhoods should never not be funded because that's how it's always been. So we're in a day and age of this shift, of this transition, that we need to start putting money into these houses and really hold people accountable. Like Erica said, no one is talking to anyone. I have been able to talk to anyone who is anybody about housing, and the shifts have not been made. Yes, the conversation has been brought to the attention of the leaders. However, the people are still living in these conditions, and people are dying. Again, they're dying.
Thank you. And at that time, I'm going to turn it over to the audience for any additional questions. I think they're coming with mics.
I'm going to stand up on this one. Thank everybody. for attending and putting yourselves in my path, I should say. We talk about trauma, we talk about stress, but we don't talk about change. And this is what I'm hearing. And I just want to raise up one trauma that brings forth a domino effect for other traumas when it comes to housing. And I want to quote what Dr. Davidson said: when kids thrive when dad is around. Dad is not around. Dads are not allowed to be around, okay? Because those who are with subsidized housing, they cannot have the dads there. And not just that, for the dads who are homeless because of a moment in their time in their past, they now got labeled with a felon. Doesn't matter how long that they served their time or paid their restitution. This is a lifelong thing. So with dads not being around, we got stress on the parent, the mother that's there. We got stress on the kids who don't have that upbringing. We got stress on the finances because dad can't pay child support because dad can't get a job that allows him to do so and have a roof over his head. I'm saying it. So my question to you is, understanding the domino effect, how do you eliminate the stress of the separation of family?
I told you it was complicated.
Well,
Yeah.
I'm going to take the question
go
for you guys, okay? So, my dear friend in the audience, so correct me if I'm wrong, because I don't work alone. We've been in the process of setting up a housing project for, well, housing pilot for pregnant moms that are in our community that are at risk of being homeless or at risk of being homeless. And we're going through all of the rules. And so I brought up that same thing. So I say things low and slow, and I get people really scared because I'm like, I don't even understand how we're gonna do this if the father can't be here. This makes no sense. And we were talking with a lady in Columbus, and she said, well, Tamika, that rule was changed. That rule was changed. And we were like, really? So Shalita and I were like, well, we need to see the page because we need to tell people in our community. So we need to look, when things do change, we need to change them in our community. The dad can be there. Even if he has a felony, the only thing that he can't be in the home with subsidized housing is if he has a if he's a sexual offender. But the felony no longer applies. And I think it was back before I was born. Was it before I was born, Shalita? Because I think I was like really crazy. Like, it was a long time ago that it had actually changed. And so we need to look and see and call, if we're in those places, see to where it can be changed, okay? Don't just think, like she said, it is what it is and that's just the way it's gonna be. No, we need to look and see, did it change? Can it be changed? We need to start looking and investigating if we are in those places so that we can help people. We come to these conferences all the time and say, oh, if we could only change these things. Well, now they have the ability to be changed. And if they are not changed now, we have the opportunity right now to change them because we have the right people in the federal offices and we need to change them now. So I think that those are some of the things that, you know, I know everybody gets into their rat race. I understand because I just came off a vacation and my calendar looked like crazy. But if you have time, you know, have some of your staff research, call. There are things that we can do to help these individuals. It's not that it's just, you know, because the father is not there. I think we need to update our policies here in the city of Akron.
Before we move on, can I respond?
Yep.
Ms. Tracy, I absolutely love you and your energy and your honesty and your transparency. So being the individual who I am and working with the women that I work with, we do provide services to the fathers within our program within certain parameters. So we try our best to not just provide these services to the women and the children, but we do understand the significance. We don't get pregnant on our own. It's a two-part thing, you know. So I'm saying all of that to say, with regard to SUMA and where I am now, we are taking steps to make sure we provide wraparound support services to the mothers, fathers, and children, and any additional support members that are providing or bridging the gap for those families. We do have a lot of grandparents that are, you know, providing care for the children and stuff, so we try to assist them as much as possible. And I've been surveying the room trying to see who all was here. And I could be wrong, but I don't see very many faces from Akron Metropolitan Housing Authority. Okay. Oh, okay. Hi. So I'm going to ask with regard to this, what are we doing to any media folk, any folks that have social platforms? What are we doing as individuals to make this knowledge known to the tenants, the people that are living in these houses? What are we doing to let them know that their significant others, boyfriend, baby dads, boo thing, you know, whatever, fill in the blank type of thing? What are we doing to let them know that their significant others are welcome to live with them and it's not frowned upon? How many of our frontline people at a lot of these housing agencies are made aware that the fathers are welcome to come in? Because I am still an AMHA resident. And it was one of those things, I've been there for a decent amount of time. But when I was filling out my applications and things, the lady that was, you know, interviewing me at the time, she wasn't aware. So Tamika and I are very close in age. So if it happened before her born date, then I'm sure it happened before mine or around the same time, and I had no idea. So I'm saying all of that to say, again, lack of communication, a lack of understanding, a lack of information and wisdom. We cannot change these things until a lot of our frontline staff are made aware that these policies have been changed. A lot of these agencies that we interact with, a lot of the Department of Job and Family Services, if the frontline people, the folks that are the gatekeepers to the files, if they don't know, we can't help change this. So platforms, social platforms, newspapers, whoever is in this room, you are now accountable for helping us make it a story. I don't care what it looks like, get it out there. As of April 28, 2022, we now know that housing restrictions for fathers with felons or felonies, with an exception of sex offenses, can now reside with their, you know, significant other. I don't know what it looks like. I'm just saying, start the dialogue. We are here for such a time in a season as this.
Dee?
So at the Freedom Block, with the Housing is a Right coalition, we are actively building tenant unions within each housing complex in the city, where we are equipping the tenants with the resources and the education of what their rights are. We are actively just building that and building a good rapport within the tenant unions, within the tenant complexes. Actively right now, we're understanding that there is a mental health issue. The neighbors are not getting along, nor do the neighbors care to even get to know each other. So we're really working towards building that good rapport to bring the village back. And our first efforts is starting tenant unions within each complex to build the momentum for them to be empowered and equipped with the resources that are allotted to them.
Thank you. Next question.
Hi, I don't know if this is the case or not, but on North Hawkins, there are, I think, senior apartments that are hosted by SUMA, and then they also have like the medical organization right there. What type of, what do we need to do to get more programs like that, if that is there, where like there's housing and then like the medical facility or access to it is right there? Because I know that transportation is a big deal for seniors, and I think the statistic is something like 10,000 people turn 65 every day now. So how do we get more programs like that, if that is a program? And what do we need to do to help to let people know it's a need?
I'll take it.
Who's having
So I'm not exactly sure of that specific project, but I can say that we have done a number of developments through our organization and through other community partners where we've kind of taken that model on where we have residents live there and then we bring in services on site so that, if we have case managers on site, we have doctors that come in and provide that medical care, both psychiatric and physical care, to bring down those barriers and make it easier for individuals to engage in those services. And again, it's all about their choice. It's about what they want and how they want that service. So we don't mandate it. It's not a requirement, but it's available if they want to take advantage of it. So we are seeing a lot of those types of housing developments occur. I will say, though, that this is a kind of a national problem that we're having that we're trying to solve on the local level. And, HUD is not really funding housing development. So we do our housing development through the IRS, through tax credits primarily. So, we have a lot of challenges in the community to bring in these types of housing and to make it more accessible to more individuals and to increase those services. But it is occurring. It just doesn't happen at the scale that we need. You look at the homeless numbers across the country and they are just skyrocketing. And, when I was a kid, homelessness didn't really exist. It was not a thing. And so, this is a pretty modern issue that we're having that we're actually just repeating a cycle. If you look past, post-World War I, you had massive, they used to call them Hoovervilles, but these massive homeless encampments on the edges of towns. And we're really replicating that same issue that occurred long ago. And, we know the answer, and the answer is housing. So, yeah.
Ms. Stevens.
So it's South Hawkins.
I usually think I talk too loud. I'm Cheryl Stevens, and I'm the president and CEO of EANDC. We did that development in partnership with Testa Builders. The first level is mixed-use retail organizational facility, and the upper levels are all seniors. And most of it's a variety of income levels, but it is exactly, is it Keith?
Yes.
It is exactly what Keith said. In order to do that type of development, we need the kind of financing that will make these kinds of projects that need low-cost money to make them happen, because we do not want the rents to be $1,200 to $1,500 a month. The rents need to be $600 to $800 a month, depending on whether you have a one-bedroom or a two-bedroom. It's for seniors. In the community areas, we provide services because we have a social worker on staff, and then we work with the county to get the right kind of social services coming in to the building itself, as well as having a tenant that provides great supportive services. So why is this more difficult to finance than anything else we do? Because the income streams that we can charge to generate from this property from the tenants is lowered because of their incomes. So what we need for you guys to do is to vote for people who will create financing that we can use at the local level.
Thank you. Oh, can we?
Tamika,
I'll
can I,
get you-
can I answer
Yep.
that? So
After that, I just want to just real quick. After you, then we'll go up here, and then we'll go over here. Okay? Okay.
So to answer that question from the healthcare perspective, I think it's an interesting question. Why don't healthcare just embed themselves into communities? And I wholeheartedly agree with that concept. I think it's all in. It's kind of a similar answer, I think, which is around resources. Is that are we able to do that on the scale that makes it worth it? And so I will answer that question also from the Akron Children's perspective. We think about the integration of that healthcare from a community perspective around schools. So welcome education into this discussion, because where do kids spend most of their time, and where are they accessible? That's in the school building. And so we've as an organization have a significant investment in moving this community school-based model, which is similar on the adult side to kind of the residential-based model.
Okay, thank you. Next question.
Awesome. Thank you all for being here. My name is Alana Bell. I'm with the Ohio Women's Alliance. We are a reproductive justice organization, and we absolutely see housing as a reproductive justice issue. And also coming from the perspective of intersectionality, when we think about abortion access, we think about all of the things that impact a person before they make the decision to have an abortion, to not have an abortion, to have the ability to parent their child in a world free from violence. And so I'm curious about what intersectionality looks like for you all as folks focused on housing, focused on safe, equitable housing for people, and how these abortion bans, which is going to impact housing, about how these Don't Say Gay bills, which is going to impact housing, particularly for queer youth. What does that look like for you all, and what is your stance on those conversations?
Go ahead, Erica.
Man, y'all ain't come to play today. That just like gut punched me a couple times. So with regard to reproductive health, again, SUMA, being a community health worker, being a survivor of a couple abortions, because I did have, a couple children super early, and then I just wanted to make sure that didn't happen again. We have partnered with Minority Behavioral Health Group as our mental and emotional aspect of wraparound services for the families we provide these services to, not to mention social workers and things in our SUMA, the Health Equity Center. Whoever spoke to that's the office I work at over by the New Seasons, the senior high rise. We do an amazing job in our little area. We do that, and I live, breathe, I move through these things. We have also partnered with adoption agencies, as far as, if should a mother decide or a family decide not to go through with the pregnancy, we've partnered with certain agencies to make sure, we try to have as smooth a transition as possible for whatever that may look like to the family. Now, again, I keep saying my little section of this. We do a great job. And we do a great job because as if y'all can't tell, I have a big mouth, and I try to utilize my platforms to the fullest of my ability. And I try to hold people accountable. But again, that's my section. I can't speak to everybody else's sections. I can't speak to everybody else's jobs, everybody else's responsibilities. But I can do my part of trying to hold people accountable. I believe these bills and these bans, again, this is where our city and county officials are coming into play. Get to know your city officials. Get to know your county officials. Vote for more than just the president elections. Understand that this stuff is impacting us at a far greater level and intergenerational levels than we can ever understand, because we allow ourselves to say yes on this bill. We don't realize that this is going to affect us for generations from now. Mm-hmm. So we have to understand, to learn to see the big picture. And I'm also a member of the Freedom Block, wherever Ray is. He's my best friend person. So again, I try to utilize my platforms. But again, it's one of those things. Understand, a vote is not just a vote for the moment. You sitting in these city and county official meetings are not just for the moment. This is for your children's children. And understand that we in this for the long haul. This is a long run. So if you winded now, sit down, take a breath, take a breather, eat, get some rest, and then get ready to pivot. So yeah, I know that was a long-winded answer. However, again, and hold your fellow coworkers, your family members, whatever that looks, start holding people accountable. We have these abilities. For those of us African Americans, Black people in the room, our people swung on trees for this. How dare you not vote? How dare you not take the opportunity to check a ballot on the box when people literally swung for you? They died for you to have this ability. This is not just us. We come in standing on the shoulders of many that came before us. So understand, how dare you not? How dare you not?
Thank you.
State legislatives as well. Yes, thank you.
Definitely.
I also want to add on what Erica said is not only you have to vote, also hold these board members accountable, because they're also investing in the community as well. There's so many different projects of these nonprofits that are in the area that are investing in housing, that are investing in the community. However, they don't know what to truly invest in. There are funds that are just sitting there that is not being invested in. When it comes to intersectionality, we need to look at the accessibility to those opportunities, to those resources. We need to make sure that all the people are getting these resources, because a lot of people are getting looked over. Because perhaps it could be mental health, perhaps it could just be how they're showing up in the world. But that has nothing to do with their access to opportunity or their access to resources. So we have to look, yes, at the politicians, but also these board members, because here in Akron, we have so many. We're like overloaded with so many nonprofits that say that they help the community, that say that they've been investing, yet, like Erica said, people have their sides of town. There has to be some sort of meeting ground to where everyone who is doing the work meet at a table. We have it at the table. That's a thing here in Akron. So we have these conversations to create true strategies that is truly sustainable, that we can be more sustainable and not reactionary. We have a lot of issues that are truly reactionary, but we need to create legacy. We need to create sustainability for efforts that we won't continue to pay for studies to tell us that something is wrong. Because the money that's going towards these studies could go towards housing, can go towards the community to create that healthy community that we truly strive for.
Thank you.
Tamika, can I answer just,
Yep.
I was going to add to we keep talking about access, and there's just a thought that continues to come through as we talk about different things related to that word access. And I think your question really helps me to kind of crystallize this thought that I've been having, which is, as much as we define what we want as access on the front end, what access really is about is whether people can get to that thing. Mm-hmm. And so part of that getting to that, whatever it is whether they're willing to accept that and whether they're feeling respected within that confines. Mm-hmm. So I think the LGBTQ example that you raised up is an important one, because we can say that things are open to XYZ individuals that have certain characteristics, criteria, whatever you want to define that as. But if that individual's not ready to accept that, if they're not feeling comfortable in that relationship, in that arrangement, they're not going to go forward in any of that. And I think that that's really important as we talk about access to all of these community resources, including housing.
Yes, I agree. Thank you. Jeffrey?
Thank you, Tamika, and thanks to the panel for being here this morning. My name is Jeff Wilhite. I direct a program called Family Promise. We get homeless families with children back into sustainable housing. We don't define the family, but one of the things that we have noticed in all the years we've been doing it, and it has frustrated us to no end, Doctor, you hit it on the head when you said access, and Dee, when you said trauma. Those are the two key things that are driving us forward. We've built a program that will get folks into home ownership. Until and unless folks own a piece of the American dream, all the counseling, all of the support, all of those things just won't get them to where they need to be. Being able to hold on to a piece of property, some terra firma that's yours, builds generational wealth for our families. And it addresses the trauma that goes with it, because mental health as well as physical health we see it every single day with our families. But I wanted to ask the panel, if any of you in your areas of responsibility, are you doing anything along that line for home ownership? And if not, how can we as a community come together? We've already got a good group of folks working with us on this project, but it's going to take a village to make the village owned by the people who live in the village.
That's true. I'm going to start to let you guys think about some things, and I'm not bragging, but I did go on vacation, and I went to Jamaica, and they are in a third world country. They are considered a third world country, right? So I was talking to this lady, and she said, you know, she's renting right now, but she's saving up her money so that she can get a piece of land. Because I was talking, you know, we talk about the houses, and that's just the way the houses are. And I was like, well, you know, some of the houses didn't look any different than Cleveland or Akron, right? But she said what they do is they save up money to get land. Because I was also talking about the fact that wasn't a lot of homeless people. Didn't see a lot of people sleeping on the street. Because they actually buy their land and build 4 walls. And then they save up more money to build 4 more walls. And she said, so the houses that you see that are big is because those families, they congregate together and they've saved up their money and they've built houses together. So that's what you see. That's not the Europeans or the Americans coming over and building. That's us. That's our homes. We've just saved up our money to build those homes. So I say that to say that maybe we could take a little bit of, note from other people, other countries that don't take things for granted as much as we do, and really work together, because they do. They work together as a community to build things up. So go ahead. I think, Dee, I don't know if you have.
Oh, yes, I have many things to say. I will say that we first need to empower our people with the idea of home ownership. I have dealt with some folks who feel as though home ownership is the farthest thing in their lifetime. So just us at the Freedom Block, we have leadership trainings every second Saturday of the month where we equipped our leaders with tools of understanding what they have access to and help them dream bigger than what they actively been living. Because a lot of people, they don't have that idea, so we assist them in helping them understand what they have access to. I continue to say access because there is a lot of people who don't believe that they have access to the resources that many of you all spoke about or that are in this room. There are many people who feel as though that they do not qualify for that. And I could just speak on behalf of just me and my coworkers that it's just been a true issue for one of my coworkers just finding a house because of her housing subsidy. The housing quality was an issue. So it's just helping people understand educating them on the programs and how they're truly allotted that dream to own a house, and then giving them that education about financing a house, because a lot of the folks that I've been working with are low income or on subsidies. Owning a house is not anything that they even try to aspire to. They're just truly trying to have a safe place to live. So to just dial it back a little, I would just truly empower the people to help them understand that this is not your be-all, end-all. You can elevate and you can be empowered to one day own a house. But it truly starts with empowering the person to be empowered to even educate themselves on becoming a homeowner.
Thank you. Dr. Davidson?
Yeah, thanks, Jeff, for the challenge. I think is quite frank with what you're saying. What do we do in our specific areas to improve home ownership and promote it? Honestly, I'm not doing a whole lot. I being like a children's hospital. This is not a conversation that I've convinced my colleagues is an important one to have in the newborn 2-month, 4-month, 6-month visit. It's not on the list of things to talk about. There's a whole lot to that reason for that, but I care about it. Obviously, I'm here. And in some ways, I'm kind of responsible for some of the challenges that go along with home ownership. If I have a child that lives in a home that's exposed to lead, that saved up, that bought a house that they can afford, and now they're up against a challenge of like the quality of that environment. And specifically, I'm calling it out because now their child has an elevated lead. We have to address that. Do we have access to the right grant that is structured in a way that it can actually support their finances? That's often a challenge. So when we have families that do own their own home, that are identified in just by the wrong zip code, honestly, it no problem of the parent themselves. Now they have to deal with this problem. So
Right.
I've called that out and made that an issue, and that's part of home ownership, I guess you could say. But I worry about that as the issue of lead causing mobility. We want to actually look at that, and actually in the lead literature, nobody's actually looked at a ton of that question. Do we incidentally make people move when we don't really want them to? But on the flip end, sometimes I'm trying to get people to work with their landlord and improving their property and making that a safe environment. And by the time they move into that actual, better space, they're ready to move on. When we looked at our kids that have elevated leads, within the 2 years that we studied lead levels and houses that are at high rates within our own community, we mapped it and looked at exactly which streets have those problems. Like 3/4 of that population was moving within that study period. I think about North Hill, a big area that has multiracial, multicultural groups within it that are all exposed to lead. That community at the time between 2012 to 2014, in the streets that we were talking about, had like 6 tenant-owned properties within that environment. This is a problem of not owning a home. So what I try to do is educate families that, around the issue of lead, is when you're buying a home, you need to ask for that home inspection related to lead. It's an added cost. Why is it an added cost? We can talk about that. If anybody has any ideas to make it not added, great. But even right now, as we are in the post-pandemic, lower accessible, again, we don't have as many housing units to even buy. There's this, people who want to buy homes are being pushed out by investors in lots of different places that aren't even any of our neighbors or friends. A lot of people are just foregoing an inspection altogether. So from my perspective, I'm trying to educate families that around the issue of lead, of what they need to look at, whether they're looking to rent a home or whether they're looking to own a home. From my perspective, as a leader of things, the issue of lead in this community, I would love for it to be a standard that tenants are asking for, that owners are demanding. I need to know what the history of lead is in this home. I need to know what you've done to this home so that I can raise my kids in a healthy, safe environment.
Before we move on, I just want to add, sorry, Tamika, I know I had to hurry up.
I'm looking at this guy over here, has told me to
Sorry.
stop.
Oh, that's a hard stop. That was a red card.
That was a red, I have 2 minutes.
2 minutes, okay, I'm gonna
And
make
then
this.
Beth wants to ask a question.
Got you, Beth. Real quick, Jeff, we do have a partnership with your organization. I have referred many a family to your program. You are much appreciated for the service that you provide. Amen and thank you. We have to hold these out-of-state homeowners accountable.
Yes.
We are also partnered with 211, the Financial Empowerment Center, and a number of our moms go through classes to buy homes, and along with renting their homes. We provide all types of education based, again, for the women we provide services to. But again, outside of us, I tell everybody to got 2 ears. Who else is doing that? So yes, man with the red card, you got it.
Thank you. Beth, real quick.
Okay, so my name is Beth Field. I am the CEO and Director of Programming of the Big Love Network. We are an environmental health equity organization in the city of Akron. So I stare at health disparity maps all day, every single day, down to the block level. It's not a coincidence that those maps are pretty much the same, with a little historical switcheroo because of Route 59, of what redlining districting maps of the whole 1939 map of the city looks like. That map was helped to be made by city officials that were appointed whenever we had a Klansman as mayor in 1925. This is a 100-year race problem in this country that is killing people. That is killing people. But neighborhood organizations such as my own, such as Freedom Block, can't get funding to ask poor people that have generationally been in this situation about what they see as next steps, let alone the people in these neighborhoods actually getting funding for those next steps. So I want to know, my question's for the room. You got some discretionary funds? You got a multi-million-dollar nonprofit that you sit on a board with? Can you please give some of these neighborhood organizations some money so we can do the real work? Thank you.
Okay, on that note, Beth has literally dropped the mic. And so I'm going to say that we're going to take a breather and go and eat and hear from Dr. Matthew Desmond. Thank you all for attending this session.